Hello, my name's Dr Edmund Farrar. I'm an ex-military doctor and I have tinnitus. Today, I'm going to tell you about how you can unlock the power of your brain to tune out tinnitus. Cognitive behavioural therapy, often referred to as CBT for short, is an incredibly powerful treatment for tinnitus. It works on the basis that how we think determines how we feel. So if we change how we think about our tinnitus, we change how we feel. In order to understand why CBT is so effective for tinnitus, we first need to understand why we notice tinnitus. Why do we hear it? So, think to the last time you noticed tinnitus. It probably made you feel frustrated, angry, sad, hopeless, fear, anxious, a negative emotion. So our body and our brain has this negative emotional response to tinnitus, and that's an automatic response. And because we have that automatic response, our brain registers the tinnitus as a threat. So your brain is like, okay, there's this thing that's making you feel really bad. I need to keep checking to see if it's there. So your brain checks, is your tinnitus there? Is your tinnitus there? Makes you think about your tinnitus. Is my tinnitus there? And then of course, your tinnitus is there. And then when you do notice it, you do hear it, it makes you feel those horrible emotions that you had before. And when you feel those emotions, it reinforces to your brain that it's a threat and your brain needs to keep looking for it. So you get stuck in this cycle of not really being able to stop thinking about your tinnitus or hearing your tinnitus. So we need to interrupt that cycle. If we can change that automatic reaction that your brain has, reduce that reaction or maybe even get rid of that reaction, the cycle will be interrupted. Your brain will no longer perceive the tinnitus to be a threat, and two things are going to happen. One, you'll stop noticing the tinnitus. You'll no longer be aware of it. Two, if you do notice it, it won't make you feel bad anymore. It won't really make you feel anything at all. If I use my own tinnitus as an example, so if I just stop talking for a second, my tinnitus is there, but I can come back to talking to you and forget about it pretty quickly. And the end result is you've tuned it out. The tinnitus no longer has an impact on your life. So we come back to cognitive behavioural therapy, CBT. CBT is the best way to interrupt that cycle I was talking about. CBT will teach you to change your brain's automatic reaction to your tinnitus so that the cycle is interrupted and you stop noticing it. CBT would typically be delivered either talking one-on-one with someone or in a group, or learning new skills through a digital program like Otto. And it's not something that will happen overnight. You won't get an overnight change, but you will start to feel better in weeks. The thing that you can do to speed up this process is practice. Practice the things that you are learning and practice them regularly. It's not something you can just do once and then your brain's reaction will be changed. You need to practice because in order to change the brain's automatic reaction, you need to teach your brain to do something different, and that just does require practice.
Cognitive behavioural therapy, CBT, is such an important tool to help you learn to change your emotional reactions to tinnitus. It's because our brain thinks about tinnitus and that affects our behaviours and our emotions. And so to break that cycle, to change that cycle, takes practice. And that's because you've had a lifetime of behaving or thinking in a certain way. And so to change that doesn't happen overnight. So you need to practice and practice and practice. And if you do that, you can get there. So some of the exercises that we use involve changing our automatic thoughts. So we think about the words that we use. If we say, for example, I'll never be able to get rid of this tinnitus, I'll never be able to sleep. If we can change that to a more positive thought by repeating those thoughts and challenging the fact that we can never do it and thinking that we can do it, that positivity, that change of negative to positive can make a real difference. And it's not magical, and it's not some kind of weird hippie kind of idea. It's because we know the power of words, and how words influence our thoughts, and we know how our thoughts affect our feelings and our emotions. So if we can change the words that we're using, can we change the thoughts that we're having, that changes our response to tinnitus. So one of the exercises that we might do is to think about the language that we use when we think about tinnitus, and then challenging and thinking about different ways of thinking about tinnitus. But another way could be sort of recognizing that we're having negative thoughts. Sometimes we don't even know that we're having negative thoughts. So sometimes it's about recognizing and catching those thoughts and then changing them. Sometimes it's about using breath work and the importance of calming ourselves down, taking a moment for ourselves, and really learning to control our breath and control our breathing. And that calms us down. That has an emotional and a physiological response. So our brain and our bodies work together, and that changes the hormone response in our bodies, which calms us down. And that can really help. So if you're having a really stressful time, perhaps some of the CBT exercises that can look at changing the language that you use and changing the breathing. When you're intense and upset, we breathe very shallowly and very quickly. When we're calm, we breathe slower, we're more relaxed. If we can enforce that on ourselves, so we can make us relax, that can really help. And that can break that tinnitus cycle that we talked about earlier. Another of the exercises that we use is often about focusing. One of the things that we do when we hear our tinnitus, all of our attention focuses on the tinnitus. So we need to change that, and we need to learn how to refocus our attention. And we know that the brain has a real difficulty doing two things at once. So for example, if you've ever had to pat your head and rub your tummy at the same time, it can be really difficult. And so what we're doing with the brain refocusing is that we're focusing our attention away from our tinnitus and teaching ourselves to refocus on something else. And that can be really helpful. One of the things that people often say to me is that they're not sleeping, they can't sleep. When they go to bed, it's quiet, they're hearing their tinnitus more. Sleep, and restful sleep in particular, is really, really important. And it allows our bodies and our brains to rest, it allows us to recuperate, and gives us the energy to cope with the rest of our day and our day-to-day responsibilities. So it's really important to get good quality sleep. We know that we sleep in certain cycles, that we have REM sleep, that we have a waking sleep, and that we have a deep sleep. And we know that some people hear tinnitus at different parts of that. And when that sleep is interrupted, it means that we are discombobulated. We haven't got all the energy. We're not very clear. We're a little bit muddled. We're not on top of our game. And so it's really important to make sure that we get good quality sleep. So some of the exercises that we do, some of the work that we do is around dumping some of our worries before we go to bed, so we're not sitting ruminating. We talk about sleep preparation, so we know about the environment that we're sleeping in. We're getting ready for bed, we're getting into a routine to go to bed. When we are children, we go to bed at a regular time. We have a routine. As we become adults, we tend not to do that quite so much. And our bodies and our natural circadian rhythm, our internal body clock, means that it's really helpful to have regular patterns and allow us to get ready for sleep. Our melatonin and other cycles change within our bodies. So our bodies are telling us that we need to sleep. But if we're listening to our tinnitus and focusing on our tinnitus, it's really hard to relax and get ready for sleep. So we need to look at all of those things together. Not everybody will have a problem with sleep, but many, many people do. And so we can use sound therapies, we can use relaxation, we can use sleep preparation programs, we can look at good sleep hygiene, we can talk about all those kind of things. And it's really important to recognize that all of those things impact on our well-being and allow us to take the time to look after ourselves when we have tinnitus. It's a strange thought to ask, can we be happy with tinnitus? Of course, none of us are happy that we've got tinnitus and that we experience tinnitus, but it doesn't stop us being happy. It shouldn't interrupt our lives. It shouldn't take away the joy in the everyday. And in some ways, it's really a call to recognise that we can find joy in ordinary things, and we can find joy in general life. So yes, of course you can be happy even though you have tinnitus. And of course you can live your ordinary life just as you did before. But it's just about taking the time to learn some techniques to help you cope better. And as those techniques become ordinary and everyday, and you notice your tinnitus less and less, those techniques become as ordinary as brushing your teeth in the morning. And you don't really know that you're taking time to brush your teeth in the morning. It's just something that you do. And so with the techniques that help cope with tinnitus, they can be just as ordinary as that. And you can get on with your life and enjoy everything that's around you. I love to read. I'm a great reader. I will read almost anything from cereal boxes to novels. And of course, when we have tinnitus, one of the things that we're told to do is avoid quiet. And I think that certainly in the early days, I would always have some sound around me. And now what I've learned is that just the ordinary general acoustics of my life and my surroundings are sufficient for me not to be focusing on my tinnitus. So I can enjoy sitting quietly reading. I live by the seaside, so I can walk for miles on a deserted beach on a winter's day. And all of those things are not particularly noisy things. I don't need to have noise around me all the time. And I can really enjoy being on my own and being quiet. I can also go to concerts and to the theatre, to the cinema. I do take hearing protection when I go to the cinema because my grandchildren like to go and watch action films, which are always really noisy. So I always take ear protection when I go to really noisy cinemas and watch films. But normally, you can learn to be in the quiet as well as in the noise with tinnitus. So even though I'm a hearing therapist and audiologist, and even though I work with people with tinnitus all the time, I still have not such good times. I have times when the tinnitus is really intrusive and really loud, and usually that's when I'm very tired or very stressed or a combination of all three, or I've got a number of things going on and I'm not balancing my life very well. And it can be annoying and distressing and frustrating when all I'm hearing is the tinnitus and I can't hear conversation and it gets very loud. And that's fine because I recognise my emotional state then, but I also know that I can do something about it. So I take myself away, I do some breathing exercises, some other exercises that I've created that I can use for myself that I know works. And half an hour later, I can be back in the game again, and I can be back enjoying what I'm doing. We can't avoid stress in our lives. We can't avoid care and responsibilities, workload, money worries, all of those things. It's life, it happens. I tell everybody that I have tinnitus. I don't wear a badge to say I have tinnitus, but I tell everybody that I have tinnitus. Those around me know that I will have moments when I need to take myself away and calm myself or redirect my attention, refocus my attention. It doesn't happen very often now, but it does happen. But telling people around you that you need that space, telling people around you that you're worried about going into a noisy place because you're worried how your tinnitus is going to react, how you're going to react to hearing your tinnitus. I think it's really important to share that information, to tell people. They won't think any less of you, and they won't think badly of you, but it helps them to understand what you're going through. It helps them understand how they should respond to you as well. So it's really important to tell people and to keep that good communication open.
So we often get asked, is it possible to live a happy life with tinnitus? And the answer to that question is yes, absolutely. I've spoken to probably almost 1,000 people with tinnitus now, and of course I've got my own experience with tinnitus, and it's entirely possible to tune it out. And for those people that have tuned it out, their life is the same as it was before their tinnitus started. The only difference is if they listen for their tinnitus, they can hear it. Or if they have a bad day, they can hear their tinnitus sometimes. From my own personal experience, my tinnitus was annoying at the beginning. It wasn't as intrusive as Anna's, and certainly won't be as intrusive as many of yours, but it still had an impact on my sleep. Fast forward to now, I probably notice my tinnitus 4 or 5 times a week. Has no impact on my life. I might have a stressful day with work or be going through some stress or tired, and then I become more aware of it, but I can very quickly distract myself and go back to what I was doing. And just to re-emphasize, my tinnitus has no impact on my life at all. So today we've talked about the power of changing your brain's reaction to your tinnitus using cognitive behavioural therapy, or CBT. We've talked about how it's entirely possible to live a normal, happy life, even though you have tinnitus. And we've talked about some positive lifestyle changes that you can make today to live better with your tinnitus. So if you found this video useful, please subscribe, leave a comment, let us know whether you've tried CBT, did you find it helpful, and we'll see you next time.